Dental implants is an area that's been around since the 50s. And it's interesting when I look at the beginning of my career, what it was like. It looked like these blades that they would stick in jaws. And then as time has progressed, it's just gotten to a point where it's a very, very predictable procedure. If there's any area of dentistry that I have really enjoyed bringing in, it's been over the last few years utilizing implants for our cases. Because here was the thing you always had in the past, is let's say you had a patient that lost a tooth. The options you had in the past was, one would be a removable partial. A lot of people don't like removable partials, and quite honestly in dentistry that's the area that I like the least, because they tend to accumulate food. It's never close to what you had originally, and it's just, everything's a compromise. And so the next option we would have is, well, if we're going to do something permanent and they've lost a tooth, then we can crown the tooth behind the space, and we can crown the tooth in front of the space, and then we can have a permanent tooth in between that's held by those two teeth and goes down, and that's called a bridge. Bridges were great. They're tried and true. I still use them every day. I mean, I've seen bridges in patients that I never saw that were been there for 40 years, so I know it's a good procedure. The problem is that a lot of times the tooth that you wanted to use as part of the bridge support was a great tooth. Nothing wrong with it. I hate to go in and adjust on a nice tooth when it has nothing wrong with it. And so that was, if the tooth had a big filling and needed the help anyway, then you felt good about it, but you just never felt like it was the absolute best we could do. It was the best in terms of dentistry at the time, but it wasn't necessarily the best for the patient. And over the past few years, implant dentistry has gotten to a level that if you think before you get into the case, you can have extreme predictability, and you've got a procedure that will last for years and years and years. Here's the beauty of it though. You're just dealing strictly with the issue you have, and you're not hurting any teeth on each side of it. And so it's opened up all kinds of options for us and allowed us to, I think, to provide even a greater service to our patients.